So now I'm going to do a head-to-toe assessment on my patient here. So first, you want to review the patient's chart to determine what size blood pressure cuff and what kind of thermometer you will be using to take their temperature. And then you just also want to see any past medical history that they have, if you're going to have any problems with being able to move the patient around if they can't sit or stand. Then you're going to enter the patient's room. You're going to close the door or pull the curtain to ensure privacy. Then you want to perform hand hygiene, as always, when you enter a patient's room. Then you would introduce yourself to the patient, get their 2 identifiers, and then at this time you can also, you're kind of just looking over your patient to make sure you know that if they're making eye contact with you, if they have any slurs in their speech. Just we're going to check to see that they're awake, alert, and oriented. So you want to ask if they have any allergies, if they're allergic to like latex gloves, for example. And then next you will ask the patient if they know the date, the time, and then, you know, or if they don't know that, if they know the season, is it near Christmas time? Is it hot or cold outside? Just to see that they know what is going on. And then you want to also see if they're up to date with current times. So at this time you would ask them if they know who the president is. Then next you will have the patient empty their bladder at this time too. And then as you review their chart, you would see if the patient needs to, if you need to collect a urine sample for that patient. So you would do that at this time. Then you will begin collecting the vital signs. So you would take their temperature, you would check their blood pressure, you would put the finger, check their oxygen saturation level, and you would also check their respirations and their pulse. So once you finish your vital signs, you want to ask the patient if they are in any pain before you begin to palpate, you know, their abdominal area or anything like that. You just want to make sure that you're not going to be causing them any pain or discomfort. So after your vital signs are collected, you will you can perform hand hygiene again, don your gloves since you will be touching the patient. So first you would start, you're gonna check, just feel around their head for any lumps, check to make sure they don't have lice or anything like that. Then you're going to assess the patient's skin color. You want to assess the skin turgor as well. Then you can check, you know, in the patient's ears. You want to check for their pupil size and how the pupils react to light. And then you want to pull down on the patient's eye. You want to look at the sclera and the conjunctiva for moisture and color. Then after you check out the eyes, move on, you can check in the nose. So you would just, you know, check for any blockage, just make sure that that looks good in there. And then you'd have the patient open their mouth and you would check if they have dentures, any signs of tooth decay, any lesions or sores in their mouth. Check their lips for moisture, color. And also in the patient's eyes too, when you're looking, you can see if they have any yellowing, any signs of jaundice. So after you do the head, you would check any distension in the veins in the neck. So once you do that, you're going to move on to the chest and the abdominal area. So you just want to kind of keep the patient covered, as we've showed before, and only uncover what you are assessing at that time. So if you need to undo the patient's gown to expose the chest, you would do so at this time. So now that you are moving down to the chest, okay, so now you will inspect the chest. You'll check the skin turgor on the chest. You'll assess the color, make sure the chest is symmetrical, and just check out their breathing as well. If you can tell that they're kind of short of breath or anything, you would ask them at that time too if they've experienced any shortness of breath when exerting themselves. And then after that, you can begin to auscultate the heart sounds for a full minute. You want to check the rate, the rhythm, and the strength. And then you will palpate the radial pulse as you're checking the patient's heart rate too. So you'll check the patient's heart rate. Then you want to auscultate the lobes, all 5 lobes of the lungs. So you'll start with the anterior side first and have the patient take a deep breath in and out. And then assist them, if they can't do it themselves, to sit up so you can check the posterior side. So you'll just start at the top, deep breath in and out, and then kind of move down in a zigzag. Checking that right here. And just listening to their lungs, make sure that sounds normal. And then you'd also ask if they have any coughing or any excess sputum production or any shortness of breath. Next, we will move down to the abdomen. So you want to, once again, if they have any tubes, any dressings, you'll check that on the chest and the abdomen at this time. And then you're going to auscultate the bowels next. So you want to assess all 4 quadrants, and you want to check for any abnormal sounds. Just check on their bowels and auscultate for about 3 to 5 minutes if you hear any abnormal noises. So once you check all 4 quadrants, next you will begin to palpate the 4 quadrants of the abdomen. So you just want to have the patient tell you if there's any pain or discomfort. And at this time too, you can ask the patient about their bowel movement. When was their last bowel movement? If they've experienced any nausea, vomiting, indigestion, anything of that nature, they can tell you at that point. And then once you finish this region, you will move on to the extremities, so your arms and your legs, your hands, your feet. So first, you're going to palpate the radial pulse, check the strength. So you can do both sides. And then you'll palpate the hands for edema. And then you want to check using the back of your hand for the warmth. So you'll do that for both sides. You'll check the patient's capillary refill time. So you'll check each finger and just press down on the fingertip, the nail bed. So once you do that, you're going to check for the patient's range of motion. So you'll lift the patient's arm up, bring it back down, bring it out to the side, checking their range of motion, and then you'll have the patient kind of grip onto your hand to test their grip and their strength in their hands. So then, after you finish with the arms, you will move on down to the lower extremity, the legs and the feet. So you'll check the pedal pulse for both feet. You'll test the capillary refill time on the toes. And then you want to check palpate the foot for edema as well, and then feel the warmth of their foot. And then you'll perform range of motion exercise. So you want to see if the patient can bend their knee, if they can move their leg outwards towards you, and then bring it back inwards, and you'll check for both legs. And then after that, you want to check for the dorsiflexion, plantar flexion on the foot. So you'll just kind of have the patient try to bend their foot back, bend their foot forward, and then now you can cover the patient back up. You would doff your gloves, perform hand hygiene, and then you would allow the patient time to ask you any questions. You would lower their bed back down, make sure the patient's comfortable, put the call light back near them, and then once the patient doesn't have any questions or they're all set, you would chart everything down, document your findings for your physical assessment, and that is it.